Personnel is policy, or so the common political refrain goes, from the Department of Health and Human Services to key positions in the White House. President Trump is stacking his administration with a staff that has major pro-life credentials. So what does this mean? What can we make of President Trump's pro-life policies so far? We're joined now by Katy Talento from the White House, who serves as Special Assistant to the President for Health Policy. Katy, thank you for your time.
Of course. Thank you, Catherine, for having me.
Our president, President Trump, is admittedly a convert to the pro-life cause. Within the administration, what is the greater vision for implementing pro-life healthcare policies throughout President Trump's term?
You're right, Catherine, when you talk about how his personal experience and friendship with someone really led him to his pro-life position. And that, I think, has really guided a lot of what we've been doing ever since I first started working on the transition team right after the election. Even during the campaign, we were planning his pro-life agenda and how it might be enacted. So I think you've seen really great steps already, and we have great steps to be continued in the future. So first of all, I mean, right away, right off the bat, the first full day he was in office, he implemented a presidential memorandum that would reinstate the Mexico City policy, which it's updated, meaning it covers more programs to reflect the current structure of foreign aid today. And what that means is that we're not going to fund the international abortion industry anymore. And so that was a really important first step. And then, of course, he also defunded the United Nations Population Fund, which is a global abortion promoter and provider. Another great step he took was to sign the congressional resolution of disapproval of the family planning program. And what it did is it didn't defund family planning. It didn't reduce family planning programs by $1. All it did was it allowed states the option to defund or deprioritize abortionists in their states. So there were a handful of states that had wanted to defund abortion providers in their family planning program with their federal family planning funding. And the Obama administration had forbidden them from doing this. And so Congress passed a resolution of disapproval of this regulation, and Donald Trump proudly signed that piece of legislation. So that was exciting. I think we've also been part of the defunding Planned Parenthood for at least 1 year and shifting those funds into community health centers. So we actually took the savings that from the Planned Parenthood funding, doubled those savings, and put them into comprehensive women's health care at community health centers. There are many more community health centers around the country, Catherine, that provide treatment for the whole woman and her children. And so it's such a better use of money to take money from the single service abortion providers and put them into comprehensive women's health care. And so that's what the Obamacare repeal and replace bill would do. We're really excited about that too. And then most recently, Catherine, you may have just seen, we had a religious liberty executive order that the president signed just last Thursday, which was the National Day of Prayer. And he had the Little Sisters of the Poor come up on the stage with him, because what it was about was saying that the government is no longer going to discriminate against you merely because of your religious beliefs.
Katy, you hit on one point, defunding Planned Parenthood. Planned Parenthood claims, though, if they are defunded, women's health care in the United States would suffer. As a healthcare expert, how do you respond to that claim?
Well, I mean, Planned Parenthood only serves part of the woman. And that's a great thing, is that we're taking these savings from Planned Parenthood and doubling them, putting them into comprehensive women's health care. We're not reducing funding for women's health care by 1 penny. And I think it's going to serve women and their children much better.
Finally, Katy, you yourself are Catholic. How do you implement your Catholic faith into your work?
Well, you know, when I first went into health policy, I wasn't really an activist on some of these social issues, the life, the marriage, but as I've worked longer and longer in health policy, and particularly I've had some great mentors, people like Senator Sam Brownback and Chairman Henry Hyde, and just unbelievable people. And now I get to work with people like Vice President Pence and Kellyanne Conway, who are just leaders in this movement. What I've realized is that human dignity is what we're all about here in health policy. And I think that's why I get so passionate about it and so fired up, is because what the coherent teaching that St. John Paul the Great talked to us about in the infinite worth of the human person, that's what we're talking about when we talk about healthcare. From women, their children, the unborn, to the end of life, the most marginalized populations. Here in America, people struggling with addiction, people struggling with HIV, people overseas who are facing preventable diseases that they see their children dying from. These are all the issues I get to work on, and it's so exciting because it all connects to that theology of the body and the infinite worth, the infinite human dignity that we have as human beings, that we're born with and endowed with by our Creator, with these unalienable rights to life. And so I love working on this issue, and it really makes me think about integrating my Catholic faith, because I'll tell you something, the central mystery of the faith and of all human history is the incarnation, right? Mm-hmm. And if there's anything the incarnation was about, it's human dignity. It's endowing humanity with the unfathomable dignity of God. And so I feel like I get to work on the incarnation every day. That's what I get to come to work on. And so it's really exciting. This is a dream come true, working here at the White House and advancing the unbelievably powerful and empowering health agenda of the president. It's an honor and it's a privilege. And I can't believe they let me in the complex every day.
Katy Talento, Special Assistant to the President for Health Policy, thank you for your time.
Thank you, Catherine, so much.